Good morning, good afternoon, good evening, colleagues. My name is Eric Opschering, and I am very pleased and honored to serve as the advisor and assistant to the project overseers of this APEC HIV project, and as a director of health and life science at Access Partnership. Welcome to the launch of the APEC Action Plan to end the HIV epidemic. Before we begin, please note that today's event is being recorded. The recording may be used for event documentation and may be shared after the session. By remaining in the meeting, you acknowledge that the session is being recorded. To open the session, I am pleased to invite Dr. Leonardo Chanqueo, Project Overseer of the APEC HIV Project and former head of the National HIV Program at the Ministry of Health of Chile. Dr. Leo, over to you.
Hi, everyone. Good evening and good morning. Can you hear me, Eric?
Perfect.
Perfect. So good evening, good morning, everyone, distinguished colleagues, representative of APEC economies, partner from international organizations, civil society, academia, industry, and communities. It's my pleasure as project overseas of these APEC projects, as a former head of the Chile's National Program for Prevention and Control of HIV/AIDS and STIs, to welcome you to the virtual launch of the APEC Action Plan to end the HIV epidemic. This is an important moment for APEC. Today is the beginning of a new phase of regional cooperation on HIV. I want to begin by thanking the APEC Health Working Group, our co-sponsor is Economy, the many experts and partners who contributed to this process, and all those who helped shape the issue paper, the policy dialogue, and now this endorsed action plan. This initiative was built with a clear purpose to help APEC economies accelerate progress towards the UNAIDS 95 targets and the broader goal of reducing new HIV infection by 90% by 2030. Our objective was to strengthen capacity, foster cross-sectoral dialogue, and produce a practical and actionable plan that help governments overcome persistent barriers to HIV prioritization, fundings, diagnosis, treatment, prevention, and care. The need for this work is clear. Across APEC, HIV remains a major public health challenge. Progress is uneven. Too many economies remains off track, incidence is declining too slowly, and it's rising in some settings. Implementation gaps remain significant even where plans and strategies already exist. The issues paper helped make this reality visible. It showed that challenge is implementation. Economies continue to face barriers related to political prioritization, laws and policies, prevention gaps, weak testing and linkage to care, treatment rotation, delayed access to innovation, and insufficient and unsustainable financing. The policy dialogue then helped turn that analysis into regional exchange and collective problem solving. It reinforced several priorities: early detection and equitable linkage to care, elimination of stigma, legal barriers, and extraction exclusion, scaling innovation and differentiated service delivery, sustainable financing and partnership, and a stronger focus on youth and other vulnerable populations. The action plan we launched today is the product of that full process. It was informed by the issues paper, shaped through multi-stakeholder dialogue, and designed to provide a roadmap for implementation, monitoring, evaluation, peer learning, and technical cooperation across APEC economies. But we should be direct. An action plan alone does not change outcomes. Progress will depend on whether economies use this platform to make difficult but necessary choices, to reprioritize HIV politically, to strengthen health systems, to invest in prevention and community-led responses, to expand timely access to innovation, and to address the structural barriers that continue to leave key population behind. It would also depend on shared leadership. Ending the HIV epidemic is not the responsibility of health ministry alone. It requires engagement across government, including finance, education, justice, and social sectors. It requires partnership with civil society, communities of people living with HIV, multilateral organizations, researchers, clinicians, and the private sector. That principle of shared leadership was central to the policy dialogue, and it must remain central to implementation. Thank you again for joining us today, for your leadership, and for your continued commitment to ending the HIV epidemic. Moving on, please join me in welcoming our keynote speaker, Dr. Jai Timbao, Deputy Director General of the National Diseases Control and Prevention Administration, China. Dr. Jai, the floor is yours.
尊敬的昌和奥博士、女士们、先生们，
Your Excellency Dr. Chang Ho, ladies and gentlemen,
很高兴出席亚太经合组织终结艾滋病疫情行动计划2026至2030年线上发布会。
it's my great privilege to attend the online launch of the APEC Action Plan to end the HIV epidemic 2026 to 2031.
我谨代表中国国家疾病预防控制局，向亚太经合组织卫生工作组及智利卫生部对本次会议所做出的周密筹备和精心安排致以诚挚感谢，向参加会议的各位同仁致以亲切问候。
On behalf of NDCPA of China, I would like to extend sincere thanks to the APEC Health Working Committee and the Chile Ministry of Health for your thoughtful preparation and dedicated arrangement for this online session. I would also like to bring my sincere and warm and cordial greetings to all colleagues attending today's launch.
艾滋病是严重威胁人类健康和公共卫生安全的重大传染病。终结艾滋病流行对于维护人类健康福祉、促进全球可持续发展具有重大深远意义。
HIV/AIDS is a major infectious disease afflicting human health and public health security. Ending HIV epidemic carries great and far-reaching significance on protecting mankind's health and well-being and promoting sustainable development.
目前，亚太地区约有690万艾滋病病毒感染者和病人。
As we speak, in Asia-Pacific region, there are 6.9 million people living with HIV.
在各国政府的坚强领导下，经过社会各界的不懈努力，防治工作卓有成效，但防治工作仍面临众多问题和挑战。
Under the strong leadership of countries' governments and with unremitting efforts from all walks of life, we have seen remarkable outcomes in prevention and treatment, yet still multiple challenges and problems.
在此背景下，智利卫生部联合亚太经合组织其他经济体、相关专家及利益相关方制定了行动计划。
Against this backdrop, the Ministry of Health in Chile, along with Asia-Pacific organizations, APEC organizations, other economies, experts, and stakeholders have jointly developed this action plan.
通过设定以全球接轨的防治目标、量化指标和政策方案，为各经济体加速实现联合国艾滋病防控目标提供务实框架，推动亚太地区艾滋病防治工作进一步高质量发展。中国对此表示赞赏。
By setting up globally integrated targets, quantifiable indicators, and policy plans, this action plan has provided a pragmatic framework for all economies to accelerate the implementation of UN HIV-related prevention and control targets and promote Asian-Pacific economies to make high-quality development in prevention and treatment. China highly commends this action plan.
中国政府始终高度重视艾滋病防控工作。回顾中国40年的防艾历程，我们始终坚持以人民健康为中心，恪守预防为主、防治结合、综合治理的工作方针。
The Chinese government has always prioritized prevention and control of HIV/AIDS. In the past 40 years, we have been upholding a people-centric approach and adhering to the working methodology by integrating prevention and treatment and having holistic and comprehensive governance.
坚持政府组织领导、各部门协同负责、全社会共同参与的工作机制。
We have a working mechanism with the government leadership, cross-sectoral and cross-cutting interagency coordination, and the whole society participation.
设立国务院防治艾滋病工作委员会，统筹全国防控工作，全面构建起从宣传干预到治疗关怀的完整防治服务体系，为艾滋病感染者提供全生命周期的健康保障服务。
At the central government level, at the state council level, we have an HIV/AIDS prevention and treatment working committee to coordinate national work. We have a comprehensive prevention treatment service system from education, awareness raising to prevention, intervention, treatment, and care, so that we have a full life cycle, life and health protection service provided to people living with AIDS.
经过多年努力，中国艾滋病经输血和血制品传播已基本阻断，经母婴和注射吸毒传播全面得到有效控制。全国整体疫情持续控制在低流行水平。
After years of efforts, the transmission through blood transfusion and blood products have been basically blocked. And in China, MTCT transmission and transmission through injecting drug use has been comprehensively and effectively controlled. The national epidemic has been sustainably kept at low prevalence.
今年是中国“15+5”规划的开局之年，中国政府将继续秉持共建共享的理念，不断完善艾滋病防治机制和服务体系，为全球，特别是亚太地区卫生治理贡献更多的中国方案。
This year marks the first year of China's 15th five-year plan. Upholding the principle of building together and sharing together, we will continuously improve our prevention and treatment mechanisms and service system so as to provide China's solution to the global countries, especially the health governance in Asia-Pacific region.
同时，作为2026年亚太经合组织东道主，中方呼吁 亚太经合组织各经济体继续深化交流合作，持续提升艾滋病感染者获得预防、检测、治疗和关怀服务的公平性和可及性。
Meanwhile, as the host country of 2026 APEC, China calls on all economies in APEC region to continuously deepen our exchanges and cooperation, continuously improve the equity and access to prevention, testing, treatment, and care services.
携手提升艾滋病防治工作能力和水平，为维护区域和全球卫生安全，实现联合国2030年终结艾滋病公共卫生威胁的可持续发展目标而共同努力。
Join hands to improve the working capacity in HIV/AIDS prevention treatment, protect regional and global health security. Let's work together to stride towards the Sustainable Development Goals of the UN and also the 2030 Ending HIV Epidemic as a Global Public Health Threat target.
谢谢。
Thank you.
Thank you, Mr. Zhai, for those excellent remarks and for underscoring, in particular, the great work happening in China, particularly around the coordination between different levels of government and the importance of health governance. And of course, thank you, China, for all of your work this year as APEC host economy. It is now my honor to introduce, for the first time in this setting, the APEC Action Plan to end the HIV epidemic. I'm very honored to do so. We won't have time to go through the entire plan in detail, but we do want to introduce you to some of the key components and the pillars and how the plan is structured. As Dr. Leonardo said at the beginning, this action plan was developed to answer a very simple and practical question. We know there is varied progress among APEC economies in meeting the 2030 HIV goals. So, what can APEC economies do, both individually but also collectively, to accelerate progress toward ending HIV as a public health threat? The reality is the scientific tools now exist to make the HIV epidemic control achievable. Long-acting PrEP, better and faster diagnostics, new combination treatment options. But of course, as Leo said, tools do not implement themselves. Progress depends on political choices, on financing choices, as Mr. Zhai said, on governing choices, legal and policy choices, regulatory choices. And that is the role of this action plan, to help APEC member economies and partners around the world make those choices. The APEC Action Plan is the result of a substantial multi-stakeholder process. It reflects approximately 15 months of work from the initial endorsement of the APEC Health Working Group project in early February of 2025 to the establishment of the APEC HIV Expert Network, then through the first APEC policy dialogue in Incheon, Korea in August, through to the publication of the issues paper in October, which analyzed the major barriers preventing economies from reaching the 2030 HIV goals, all the way through the development of the action plan and the launch where we arrive today. This action plan reflects input from more than 75 individuals. Those individuals are government policymakers and advisors, representatives from multilateral organizations and civil society, academia, industry, clinicians, people living with HIV, and represent 19 of the 21 APEC economies. Indeed, In my recollection, this is one of the most widely participated in APEC Health Working Group projects in a long while, with 19 out of 21, and many other non-APEC economies as well, many of which are represented here today. I also want to recognize our sponsor, Chile, again, for their leadership on this project, and also our co-sponsors, Japan, Peru, Singapore, Chinese Taipei, and Thailand. And also thank our co-host of this launch and our APEC host economy in 2026, China. So the action plan is organized around 6 pillars, and it includes 8 different targets, 11 indicators, and 31 recommended actions. Each of the 6 pillars corresponds to the major barriers identified through the issues paper and validated through the dialogue. Each pillar includes a context section. This defines the challenge and explains why a particular action or set of actions is needed. Each pillar includes 1 or more targets. These are the outcomes that APEC economies have agreed to aim to achieve by 2031. Many of these targets are aligned with and complement the UNAIDS targets in the 2026 to 2031 strategy. Each target is linked to 1 or more indicators. These indicators help economies assess whether progress is being made, and they also help support transparency, peer learning, and accountability. Nearly all of the 11 indicators are aligned with existing data sources from UNAIDS, from WHO, from Georgetown University's HIV Policy Lab, and other data sources, so we're not reinventing the wheel. Each pillar includes a set of recommended actions. These actions provide a menu of practical policy measures, regulatory changes, different ideas for programs and system-level changes that economies can consider. These actions are not exhaustive, and they are not intended to be applied identically everywhere. They are supposed to be fit for purpose. They are meant to be adapted to local epidemiology, local system capacity, domestic legislation and regulation, and the different realities that are happening on the ground in the different APEC economies. I'm going to go through each of our 6 pillars, very briefly describing what the problem is that pillar is trying to solve, and some of the recommended actions. On the screen, you'll also see the targets that are part of those pillars. But of course, we encourage you to check out our website, apec-hiv.org, for the full action plan. Pillar 1 is to foster political commitment, multi-sectoral collaboration, and sustainable domestic financing. The problem this is trying to solve is that HIV has fallen off the political agenda in many settings. This leads to weakened budgets, slower policy change, fragmented implementation, and reduces support for prevention and community-led services. So the actions under this pillar focus on renewing that political commitment, updating and funding domestic HIV strategies and plans, strengthening multi-sectoral coordination, engaging ministries beyond health, like Dr. Leo said in his remarks at the beginning, to justice ministries, education, social services, and building more sustainable domestic financing models. Pillar number 2 is to address legal and policy barriers to access to HIV services. The problem this is trying to solve is that just the availability of service does not guarantee real access. There sometimes can be laws, policies, rules around consent, policies around confidentiality and data privacy, requirements around documentation, identification, and restrictions on service delivery that can actually deter people from seeking HIV services. So the recommended actions here to achieve this target focus on reviewing those legal and policy barriers, clarifying consent and confidentiality rules, reducing those different administrative and procedural obstacles to testing and care, and supporting non-discriminatory service delivery with a focus on reducing stigma. Pillar number 3 is to expand access to PrEP and other HIV prevention tools. The problem that pillar number 3 is trying to solve is that prevention coverage indeed remains far too low in the APEC region and indeed globally for us to meet our 2030 goals. PrEP access is inconsistent, eligibility criteria might be too narrow, provider readiness varies, costs remain a barrier in some settings, and other prevention tools like safe sex practices and condom distribution remain under-supported. The recommended actions in this pillar to achieve this target focus on updating PrEP policies and guidelines, expanding delivery through public and community-based channels, strengthening provider capacity, including physicians, nurses, community health workers, pharmacists, integrating PrEP into combination prevention packages, and preparing health systems for long-acting prevention options which are coming to market. Pillar number 4 is to improve HIV testing coverage and strengthen linkage to care. The problem that Pillar 4 is trying to solve is that testing gaps and weak linkage systems remain major breakpoints in the HIV care continuum. People may face stigma. Testing sites might be inconveniently distributed throughout a region or throughout an economy. Out-of-pocket costs for people remain high. Confirmatory testing sometimes is slow or cumbersome after an initial positive test. Referral systems can be fragmented, or there could be delays between diagnosis and treatment. So the actions in this pillar to achieve the targets that you see on the screen here include a focus on expanding HIV self-testing, community-based testing, and facility-based testing, like in emergency rooms, and routine opt-out testing where appropriate. It also includes measures like simplifying confirmatory testing pathways, strengthening referral systems, and improving case management so that diagnosis leads quickly to care. For example, relying and introducing on new technology-based tools through SMS text or apps. The penultimate pillar, pillar number 5, is to enable prompt HIV initiation, HIV treatment initiation, retention, and to minimize resistance. We all know that a huge problem is that people still face delays in starting ART after diagnosis, and many face barriers to staying engaged in care over time. Retention can be weakened by stigma, challenges accessing clinics due to geographic distribution, or even the hours that clinic is open, workforce constraints, people's ability to take off of work to initiate and be retained on treatment, interruptions in medication supply, limited psychosocial support for people living with HIV, and weak health information systems. The recommended actions under this pillar, pillar number 5, focus on same-day or rapid treatment initiation where appropriate, differentiated service delivery, multi-month dispensing where that's appropriate, community and peer-based support, active re-engagement of people lost to follow-up, routine viral load monitoring, and stronger systems to detect and respond to treatment failure and drug resistance. Without further ado, the final pillar, pillar number 6, is to strengthen regulatory and reimbursement pathways for long-acting HIV prevention, new HIV testing innovations, and new HIV treatment innovations. These new HIV tools can sometimes be delayed or underutilized even after available through regulatory pathways in APEC economies. Regulatory review, reimbursement, health technology assessment, formulary inclusion, procurement, provider training, and financing all shape whether innovation actually reaches the people who need it. So the recommended actions in pillar number 6 focus on accelerating appropriate regulatory pathways, for example, using reliance and work-sharing mechanisms where feasible, strengthening reimbursement and HTA processes, making sure that economies consider including new HIV medicines, preventatives, and diagnostics into benefit packages, updating clinical guidelines, and preparing health systems to deliver new technologies equitably. So 2 points in closing. First, because there's a large number of non-APEC economies in the virtual room tonight, we want to make sure that everyone understands that we have seen evidence before in other APEC projects that APEC outputs like this action plan can actually be useful and effective and impactful not only for APEC economies, but other economies around the world. So we encourage you to get in touch with us, with our sponsor, co-sponsoring economies, to explore how you can help implement the action plan in your economy, whether it's an APEC or not. Second, this is just the beginning of a new era in APEC for HIV. There are a couple different proposals in development and discussion to continue working on HIV. For example, with plans to create a regional dashboard to track progress, organize a second APEC HIV policy dialogue in Dalian, China in August, arrange consultations in individual economies to support implementation of the action plan. And additional proposals are in the works by some of our co-sponsors to organize additional activities this year and next year related to HIV prevention. With that, I will turn us now to the implementation segment of our agenda, where we will hear directly from APEC economies on how this framework can be applied in HIV plans, policies, and programs. So with that, I will stop sharing my screen and I will introduce our first speaker in this segment of the agenda. So first, I am pleased to invite Dr. Carlos Manuel Benitez Villafane, Executive Director for the Prevention and Control of HIV/AIDS, STIs, and Hepatitis at the Ministry of Health of Peru. Dr. Carlos, the floor is yours.
Thank you, Eric. And is okay my presentation?
Perfect. Yes, we can see it and he can hear you.
Okay. And good evening on the Pacific and good morning on Asia. Thank you to the organizers, Eric and Dr. Leonardo, for inviting me to this important event. My name is Carlos Benitez. I am the head of the HIV program in Peru, and I will be presenting the country's progress within the framework of the APEC plan for the elimination of HIV. Peru is a country located on the western coast of the Pacific Ocean with a population of 34 million. The country is traversed by the Andes Mountains, forming 3 natural regions: the coast, the Andes, and the Amazon Basin. On this first slide, we have the HIV program data for the country, showing 3 facts. One, an epidemic concentrated in among key population, MSM, 10% of prevalence, transgender woman, 32%. 2, a higher rate of HIV in the Amazon regions, Amazonas, Loreto, and Ucayali in the Amazon basin. And 3, a decline in the number of new diagnoses reported since 2024. The country provides universal access to HIV diagnosis and treatment for both nationals and foreigners. Here are the most important interventions for HIV control. In prevention, a comprehensive prevention package is available, including counseling, condoms, treatment for sexually transmitted infections, post-exposure prophylaxis, and pre-exposure prophylaxis with antiretrovirals. For diagnosis, the country uses rapid immunochromatographic tests for HIV, syphilis, and viral hepatitis, as well as molecular tests at the primary care level through the GeneXpert platform. For treatment, the regimen of choice is a fixed-dose combination of dolutegravir, and the centralization of any retroviral treatment to the primary care level has been implemented. I will now present the activities we have been implementing in accordance with each of the 6 pillars of the APEC plan. Under Pillar 1, governance and multisectoral work, the country has a national multisectoral health policy called Peru, a healthy country by 2030, which includes topics such as HIV, viral hepatitis, and other infectious diseases. We have multisectoral coordination bodies such as the National Health Council to the Commission on Communicable Disease and the National Multisectoral Health Coordination Body known as CONAMUS. Pillar 2, regarding legal barriers, we have been working with civil society to update the HIV law in Peru. Furthermore, Peru, together with the countries of the Andean region and through the Andean Health Organization, has implemented the Andean Plan for the elimination of stigma against people living with HIV, which is supported by UNAIDS. On Pillar 3, the country updated its prevention policy in 2023, adding oral PrEP to the prevention package. As you can see, to February of this year, PrEP is available at 204 healthcare facilities across all regions in the country, with more than 90,000 people having access to PrEP. The goal is to reach more than 17,000 people enrolled in PrEP by 2026. Regarding to access to HIV testing, the volume of testing in the country is high. Only in 2025, more than 3 million HIV tests were conducted in Peru, achieving, for example, 48% screening coverage among the MSM population, 48% on transgender woman population, and 73% on female sex workers. This is being made possible by the available of rapid tests as well as a specialized STI HIV service, the peer educator strategy, and community-based service delivery. Under Pillar 5, antiretroviral treatment, the country has achieved 84% coverage on the estimated population of people living with HIV by 2025. This has been made possible by two key interventions. One, the simplification of any retroviral treatment on a dolutegravir fixed dose combination. 90% of all the people living with HIV on treatment use ALD, and the decentralization of any retroviral treatment on the primary care level in Peru. And all of this has led to a significant improvement in HIV impact indicators. New infections, reduction by 5%, and mortality, reduction in 3% between 2021 and 2024. Regarding Pillar 6, and although, as you know, we don't yet have access to lenacapavir, a cost-effectiveness study has been conducted with the support of UNAIDS. Its results will be important when the time comes for its inclusion on the list of medications for PrEP. In addition, in collaboration with PAHO, we are conducting a pilot study on the management of advanced HIV disease, including rapid diagnostic methods for opportunistic infection with promising results. Finally, with regard to potential areas of collaboration, we have identified two: technical exchange, regular APEC events to present progress, innovations, and results in the implementation of interventions; interinstitutional collaboration to integrate HIV into broader regional agendas, particularly with regard to regulatory mechanisms for access to new technologies. Because the goal is to end the AIDS epidemic by 2030. Thank you.
Thank you so much, Dr. Benitez. I now invite Dr. Wong Chen-Xiong, Director of the HIV Hepatitis STI Division at Singapore's Communicable Disease Agency for Singapore's intervention. Dr. Wong, the floor is yours.
Hi, can you hear me?
Yep.
Yeah,
all right.
Yes, here.
Okay. I'm just going to sort out the audio issues here. Can you mute? All right. So my name is Wong Chen-Xiong, and I'm the director of the HIV Hepatitis STI Division and the National HIV/AIDS Program of the Communicable Diseases Agency in Singapore. Thank you to the organizers for the invitation to share Singapore's intervention plan at the virtual launch of the APEC Action Plan to End the HIV Epidemic 2026 to 2031. The framework that we have for a multi-sectoral response in Singapore recognizes that HIV infection is a public health priority in Singapore. Over the past decade, HIV incidence has declined steadily. The National HIV/AIDS Program under the Communicable Diseases Agency manages and mitigates the impact of HIV/AIDS in the country. Guided by the National HIV Prevention and Control Committee, the program brings together prevention, education, treatment, and support for persons living with HIV. The committee also provides strategic oversight to ensure that Singapore's HIV response remains aligned with national priorities and is responsive to the evolving epidemiologic landscape. Our approach towards a sustainable HIV response and APEC Action Plan alignment recognizes, firstly, the progress that we have made in terms of our 95-95-95 targets. Today, 90% of people living with HIV in Singapore know their diagnosis. 96% of those diagnosed are receiving treatment, and 94% of those on treatment have achieved sustained viral suppression. Singapore remains committed to the UNAIDS targets and adopts a multi-pronged approach across the HIV care continuum. Our key pillars are, firstly, preventing spread of the disease and combating stigma through education, encouraging testing by increasing treatment options and testing options, and utilizing innovative approaches to increasing testing, and facilitating treatment uptake by improving access and affordability. These directly align with the APEC HIV Action Plan's emphasis on stigma reduction, testing innovation, treatment access, and regional collaboration. Looking at the most relevant recommendations and incorporation plans for the APEC Action Plan, what do we plan to do here? The plan's recommendations on reducing stigma, expanding testing access, and ensuring treatment sustainability are most relevant to Singapore. We incorporate them through annual national HIV campaigns, broadcasts on radio, social media, and other media, emphasizing the traditional ABCD approach, abstinence from casual sex, being faithful to one's partner, correct and consistent condom usage, early detection, and treatment. Education messages are tailored for both the general as well as high-risk key populations. Sexual health education is also integrated into school science curricula, and the Mandatory Empowered Teens or e-Teens program, which provides youths attending school with accurate HIV information, knowledge about protection strategies, and life skills like assertiveness and negotiation. Workplace initiatives, healthcare workshops, World AIDS Day events, and community fora further reinforce HIV prevention and reduce stigma. We also plan to implement innovative approaches in line with APEC goals and one concrete action to accelerate HIV outcomes through encouraging testing. Singapore continues to expand testing access to facilitate early detection, early treatment, and improve quality of life for people living with HIV. Early detection, we know, also helps to reduce onward transmission. Over the years, Singapore has implemented several strategies to encourage HIV testing amongst different population groups, including the implementation of 10 anonymous testing sites across the country, as well as routine antenatal screening, which have essentially helped to eliminate vertical HIV transmission in the country since 2008. New innovative testing approaches, such as HIV self-testing, have also been introduced as an additional testing modality. A key action to accelerate outcomes is the nationwide rollout of HIV self-testing kits in the country since January 2025, providing a convenient and private option to normalize HIV testing and reach individuals who might otherwise not test. We recognize as well that there are hardest to reach populations and the importance of removing barriers and adapting our plans to reach these populations. Stigma and misconceptions remain the primary barrier deterring key populations from testing and getting treatment. To address this, Singapore has enhanced interventions for high-risk populations with a focus on increasing access to testing, promoting condom use, and encouraging early testing. Collaboration with civil societies provides tailored support, education on safer sex, and free HIV testing and counseling to those at risk. Specialized education for sex workers and their clients focuses on STI and HIV risk awareness, condom use, and regular testing, while programs for men who have sex with men emphasize HIV prevention through various modalities. Facilitating HIV treatment. So Singapore's support for financing HIV treatment adheres to our overall healthcare philosophy of balancing healthcare access, affordability, and sustainability. Substantial subsidies for key HIV medication under the standard drugs list and the Medication Assistance Fund greatly reduces the monthly cost of first-line antiretroviral therapy. Patients can also access MediSave, a national savings scheme with mandatory contributions and government top-ups, and Medis Fund, safety nets through medical social workers, whilst community organizations provide essential psychosocial support for people living with HIV. Together, these measures ensure a comprehensive and sustainable approach to HIV treatment and care. In closing, HIV remains a key public health priority for Singapore, and we are committed to achieving the 95-95-95 targets through our comprehensive economy-wide and nationwide response. Singapore looks forward to collaborating with APEC economies in developing an actionable regional plan that advances our shared goal of ending HIV/AIDS in our lifetimes. Thank you very much.
Thank you, Dr. Wong. I now invite Dr. Pin-Hui Li, Medical Officer at the Taiwan Centers for Disease Control, Chinese Taipei.
Could everyone
Dr.
hear me?
Yep, we can hear you, Dr. Li.
Good morning, good afternoon, and good evening, Chair and distinguished delegates from all APEC economies. It's my honor to join the online launch and to represent Chinese Taipei to share our progress, challenges in HIV prevention and control, and also supporting the APEC Action Plan to end the HIV epidemic. Chinese Taipei has made significant strides toward the UNAIDS 395 targets, with newly reported cases dropping below 1,000 annually and a notification rate of newly diagnosed HIV of 3.8 per 100,000 population in 2025. Our 2025 performance is estimated at 93, 96, and 95. While we have achieved the second and the third targets of UNAIDS, we remain fully committed to closing the gap on the first 95 and also to increase our contribution in the regional and global collaboration and health security. Regarding the implementation of the APEC Action Plan to end the HIV epidemic, our current strategies also align closely with the multi-sectoral collaboration and interventions. We have institutionalized these efforts through our 5-year plan for the elimination of HIV and STIs 2027 to 2031 to ensure long-term continuity and sustainability on resources allocation to HIV prevention and control. To accelerate the progress approaching the first 95 targets, we are currently focusing on the Pillar 2, address legal and policy barriers to access to HIV services, and Pillar 3, expand access to the PrEP and other HIV prevention tools of the action plan. A cornerstone of our strategy is the expansion of the national government subsidy PrEP program. We have tripled the number of participating contract PrEP care facilities from 37 in 2021 to 121 in 2025. This scale-up has led to a significant increase in the PrEP enrollment, growing from 1,542 individuals in 2021 to a cumulative total of 11,440 individuals by the end of 2025. Through close collaboration with local health bureaus and medical institutions, we continue to provide tailored integrated services and diversify screening channels, including HIV, self-testing for high-risk populations. Furthermore, our strategy prioritizes prevention, early diagnosis, and immediate treatment when HIV is diagnosed. In order to ensure service continuity, Chinese Taipei has integrated HIV care into Universal Health Coverage, UHC, with all co-payments fully reimbursed from the government budget. Adolescents and young adults face significant barriers to HIV and STIs prevention and testing, with stigma, limited access to youth-friendly services, and gaps in the sexual health education remaining as ongoing concern. Additionally, the rising incidence of co-infections such as gonorrhea and syphilis among youth necessitates a more integrated approach. To address these challenges, we have collaborated with the Ministry of Education to strengthen sex education. We also work with hospitals and care facilities to establish an anonymous STI consultation platform, providing anonymous free rapid syphilis and HIV screening for young people and students aged under 24 years across almost 80 hospitals nationwide since July 2025. Free HIV self-testing has been provided to students in universities, colleges, and senior high schools. Furthermore, clinical guidelines for STI management have been updated in partnership with professional medical societies to ensure quality and standardized care. In our implementation, we have identified specific challenges in reaching certain populations. For sex workers who often operate underground due to legal constraints, We collaborate with non-government organizations to provide discrete peer-led outreach services on screening. For women who may perceive themselves as low risk of acquiring HIV and STI, we are intensifying targeted health education to raise risk awareness. A primary hurdle in our current implementation is the systemic shift from current opt-in policy toward opt-out screening. We are keen to learn from the practical and regulatory experiences of other APEC economies to develop a model best suited to our domestic context. To further this dialogue, Chinese Taipei will host an international symposium on opt-out testing this October for in-depth technical exchange. Furthermore, we plan to propose an APEC workshop in 2027 to discuss innovative strategies, digital health, and care for migrant populations, and we cordially invite all economies to join us. In closing, Chinese Taipei believes that mutual exchange of practical expertise is the cornerstone of regional and global collaboration. Having developed mature models for HIV self-testing and PrEP promotion, we are eager to share our insights within the APEC framework to close the gaps together and achieve the global goal of ending the HIV epidemic by 2031. Thank you.
Thank you very much, Dr. Lee. And thanks to all three of our economy speakers. We can now broaden the discussion from economy implementation and consideration of the action plan to regional and global support. So we're now asking how multilateral and technical partners like USAID, like UNAIDS and PAHO can support governments in APEC economies and beyond to end the epidemic of HIV. So I'm very pleased to invite Mr. Eamon Murphy, Director of the Regional Support Teams for Asia Pacific and for Eastern Europe and Central Asia at UNAIDS. Mr. Murphy, the floor is yours.
Thanks very much, Eric. Dear colleagues, partners and friends from the APEC economies, good morning, good afternoon, and good evening. I'm speaking here from Bangkok, but I also speak on behalf of my colleague, Luisa Cabal, who's the Regional Director for Latin America and the Caribbean. So let me start by acknowledging the work behind this action plan and congratulating the team and the many partners that Eric showed in his introduction who have developed, finalized, and endorsed it. But as other speakers have said, the plan itself, whilst it's really good, is only going to be as good as the implementation of it. The plan comes at a critical moment for the APEC economies and for the world. The challenge in ending AIDS, as we've heard, is no longer technical. We have the tools. We've heard from some of the economies how they're implementing the new innovations, the different tools. The challenge for us all is sustaining the response amid the fiscal pressures, the health system transitions, and competing priorities. From a UNAIDS perspective, this action plan is more than a political signal that APEC economies remain committed to ending AIDS. It was impressive to see that so many have engaged in development of this plan. It's a practical decision-making tool. It gives the governments and their partners a clear basis to prioritize HIV in the national budgets and discussions, to shift resources towards prevention and communities where our biggest gaps across the regions are, and to remove the barriers that still limit access to services. It also closely aligns to the Global AIDS Strategy 2026 to 2031. Both recognise that AIDS requires sustained domestic financing, people-centred and integrated services. There's innovation and scale-up. We heard from a previous speaker on PrEP. It's not good enough to introduce PrEP. We have to get it at scale to have a community benefit and protection. Some of the economies in APEC are achieving this. Others really need to shift their priorities, their political decisions, their programmatic decisions, not just financial applications. It's also about the protection of rights, human rights, and strong community partnership and leadership. We know that progress across APEC economies remains uneven. Some economies are close to key targets and achieving the 95, 95, 95 targets, as some speakers have already addressed, while others continue to see persistent or rising new infections. Some of the fastest growing epidemics in the world are now in our APEC economies. Particular concern for us are the Pacific countries, which are facing rising infections at a time when many countries are bringing infections down. So particularly among the key populations who are often unable to access the services they need when they need it, which is for their own benefit, but for our communities as well. We also know where the gaps are. As said, HIV is losing priority in some countries. The funding is not aligned to where transmission happens. We know the science, we know the application, but why is the funding being put in things that will have a lower impact and lower benefit? Prevention is not delivered at scale. The community systems are underused. The best responses to HIV in the world are those that are done in partnership with communities as decision makers, but also as deliverers of services to communities that are hard to reach or feel it difficult to access some of the mainstream health systems. But equally important, and finally, the legal and policy barriers that still limit access in a number of the economies. At the core of these gaps is sustainability as we move forward. Finances are changing across the world. The Global Fund for AIDS, TB, and Malaria has indicated closeout for the next round of funding for many countries, and it will continue. The international development assistance system is changing, so sustainability is going to be critical. And it's not only about funding, it's about the strong systems. It's the integration of HIV and other communicable diseases into the broader health services. The sustained political commitment, which is critical, and communities at the center of the response. So let me reiterate, communities should be recognized not as beneficiaries or clients of our services, but as co-implementers and accountability partners. UNAIDS supports countries across the APEC economies and globally to make these shifts, to embed HIV within health systems, to ensure services are accessible, affordable, and stigma-free, and to use the data that is collected more effectively to focus efforts where transmission is actually happening. UNAIDS also plays a convening role. We bring together a wide range of partners across the United Nations. We work to bring together governments, communities, the multilateral partners, the private sector, and donors around shared priorities, common indicators, and coordinated investment in all its forms. So partners reinforce rather than fragment the national responses that you're responsible for. From now to 2030, accountability must mean more than reporting. It must mean the clear choices and course correction that can easily be made to get many more economies on track to achieve the targets of ending AIDS as a public health threat by 2030. So are we funding the right interventions? Are we reaching the people most affected? Are policies enabling access or blocking it? These are critical questions. As the world prepares now for the 2026 United Nations High-Level Meeting on AIDS in June, the end of June, the final phase of the response requires political attention and practical decisions. I hope the colleagues from APEC economies can talk ministries of health, talking to ministries of foreign affairs who will represent their economies at the meetings in New York to prepare for the political declaration to make sure the right components are included that will support your responses at the national level across the many countries involved in APEC. So we need to protect in these decision-making the community-led services, the sustained financing, and ensure the equitable access to full range of HIV services, and looking forward, the integration into the wider health system and social protection services, but critically focusing on those populations where we know the epidemic is largest. This action plan is not about new ideas, it's about making existing solutions work at scale. We have the tools, as we heard earlier from Eric and others. We have the evidence. What matters now is whether we act consistently and with focus to get the job done in these last miles. UNAIDS stands ready to work with APEC economies to keep this commitment strong and to ensure that today's launch translates into lasting impact. Thank you very much.
Thank you, Eamon. Really important points, bringing it back to the importance of community and civil society and people living with HIV, not as beneficiaries, but co-implementers. Great takeaway. I now invite Dr. Monica Alonso Gonzalez, Unit Chief for HIV, STI, TB, viral hepatitis, and malaria at the Pan American Health Organization, for your remarks. Monica, the floor is yours.
Thank you very much, Eric. And I would like to greet colleagues from governments, from the academia, civil society, from the industry, and also salute very warmly Dr. Chanqueo, Dr. Benitez, and Dr. Mojino and Mr. Mojino from the Americas, and also Dr. Timbao, Dr. Wong, Dr. Lee, and Mr. Murphy from Asia Pacific. So it's very much a pleasure to participate in this event for the launch of the APEC Action Plan to end the HIV epidemic. And I would like to congratulate APEC and all its partners involved in this important effort. The action plan provides a timely framework to accelerate progress towards the 2030 goals. And it also recognizes that economies are at different stages in the HIV response. For PAHO, this approach is also very relevant to the Americas. And while in our region we have made important progress, as was showed prior by, for example, Dr. Benitez, in expanding treatment and improving survival and introducing new prevention tools, but progress is uneven, and we still have gaps in reaching that elimination goal. We still have barriers that are particularly around, for example, sustainable financing in a context where donor support, especially to middle-income countries, is declining, and prevention and testing and community services are often the first affected. Also, in our region, prevention coverage needs to be expanded. PAHO modeling is showing us that PrEP coverage and the number of persons on PrEP would need to increase fivefold to enable the region to reach elimination targets. Also, in order to close the final gap in our cascade, for example, health system models for HIV services need stronger integration into primary health care and also supported by reliable supply chains and stronger data systems. Of course, we need to address stigma and discrimination and legal or administrative barriers that prevent people from accessing and remaining in care. And we know that those are drivers of late diagnosis and poor retention and care that continue to limit impact. Also, accelerating the transition from new evidence to policy and to implementation is very important to be able to scale up innovations and modernize service delivery and strengthen the public and community partnerships and formally integrate communities into national strategies. So given these challenges, it's very important that governments prioritize financing for HIV in a sustainable manner and strengthening that primary health care based health system for that person-centered approach. So for PAHO, and very much in alignment with the APEC Action Plan and the 6 pillars, we recently launched the Alliance for the Elimination of HIV in the Americas, which is a regional platform that is designed to enhance and align political commitment, technical cooperation, country planning, and partner engagement around the common elimination agenda. And through the alliance, PAHO is supporting countries in diagnosing implementation gaps and strengthening their national plans and improving their information systems and scaling high impact interventions. And we will soon launch what we are calling the Path to Elimination. That is a formal recognition of countries that are making sustained progress through tiered certification. Some other examples of our region that I would like to share are for regional cooperation, for example, is in the area of market access. So by working together to improve demand forecasting, sharing information on prices, pooled procurement, and coordinating negotiation, such as with the PAHO Strategic Fund, countries can secure more timely and affordable access to medicines, diagnostics, and prevention commodities. Another area that was also mentioned before that I will just briefly mention is the regulatory cooperation for such as regional reliance mechanism, joint reviews, and exchanges between regulatory and health authorities that can help incorporate important technologies. And the last one would be implementation learning, so that countries should not have to repeat the same pilots in isolation and be able to learn from one another's on what works and where it works. So this launch, we see it as the beginning, but we believe that this plan is a very strong instrument to catalyze the national dialogues, financing commitments, regulatory pathways, and promote those community partnerships. And from PAHO, we look forward to collaborating with APEC in partners through the Alliance for the Elimination of HIV in the Americas, and we're committed to sharing implementation experiences and supporting countries towards elimination. So thank you for the invitation to participate in your launch. Thank you, Eric.
Thank you so much, Monica, for that, and especially for highlighting your new alliance and new pathway to elimination. And I think I speak at least for those involved in this project, but probably for all of the APEC economies here, that we welcome continued collaboration with PAHO. Indeed, I think I hear many, many times every APEC project that I'm involved in that one of the great values of APEC is that it has that it's a bridge between the Asia Pacific and Latin America through our member economies, Chile, Peru, Mexico. And so allow us to be that bridge and to continue sharing best practices from the Americas and from PAHO to Asia, and from Asia to the Americas. So thank you for that. And thank you to both UNAIDS and PAHO for your continued support. To close today's launch event, I am very pleased to invite Mr. H. Rodrigo Mojeno, President of America Viva and General Director of Fundación Mexico Vivo. Rodrigo, the floor is yours.
Thank you very much, Eric. I greet everyone joining this important launch today, and I want to start by expressing my gratitude for this invitation to address you this morning, and of course for all the strategic, meaningful, and hard work done by this group to achieve this action plan and the contribution it means for the region. I would also like to start by saying something that rarely gets said clearly at moments like this one. We are behind. Almost 7 million people living with HIV in our region, 1 in 4 of all new global infections. And the APEC region, with all its economic power, its scientific institution, its policy architecture, is not on track to meet the 2030 targets. Not because we lack the knowledge, not because we lack the tools. We do have the science, we have the medicines, we have the roadmap, and today we have this powerful action plan. What we have lacked for too long is a political empathy to act as if the life of the peoples most affected by HIV actually matter. I say this not to diminish what is happening today. The endorsement of this APEC Action Plan is a genuine achievement. To those who spend months building it, the governments, the researchers, the multilateral organizations, the technical experts, I acknowledge your work with real respect. This framework is sound, and the 6 pillars are the right pillars. Its targets are the right targets. But here's what I need to express to you from where I stand. An action plan is not an action yet, and our times require accelerated action. I have been doing this work for more than 20 years, and I have seen impeccable technical documents launched at political events. I have watched governments applaud commitments they never funded. I have watched legal barriers remain untouched because addressing them felt politically inconvenient. And I have also watched communities, the very communities who carry the heaviest burden of this epidemic, be thanked in opening paragraphs and then left out of the room where decisions are made. That cannot be the story of this action plan if we want to succeed. Community organizations, networks of people living with HIV, civil society, we're not symbolic participants. We're not ornamental. We are infrastructure. We are the ones who find the people that formal systems miss. We are the ones who sit with someone the day they receive their diagnosis and help them take the first step toward care. We are the ones who build trust where trust has been broken by stigma, by discrimination, and by fear. And we're also the ones who every day witness something that no policy document fully captures: the scale of human mobility. People crossing borders, moving between cities, living between systems, carrying with them not only their lives, but their health needs, their interrupted treatments, their unfinished linkage to care. People in mobility are among the most exposed and the least reached. Any implementation of this action plan does not build empathic, resilient services for the people on the move, services that follow people, not just wait for them. It will leave behind some of the most valuable, vulnerable among us. If communities are not funded and strengthened as part of the implementation architecture of this action plan, not as recipients of charity, but as partners with resources, experience, authority, and accountability, then this plan will not deliver on its promise. Now, I would like to address something about prevention, because science demands it. We need sufficient condoms and prevention commodities. We need STI diagnostic tools within reach. We need post-exposure prophylaxis available when something goes wrong, and we need PrEP in all our countries. Urgently, we need injectable PrEP. Science has given us a 2-dose per year regimen to prevent HIV. Clinical trials show efficacy that creates an ethical obligation to act. For many people, disproportionately those living under the weight of inequality, with demanding work schedules, with children, with everything life puts on their shoulders, for those people, the difference between a daily pill and a twice-yearly injection is not a preference. It is the difference between accessing prevention or not accessing it at all. Pillar 3 of this action plan sets a target of 50% of people at sustainable risk using antiretroviral-based PrEP. We will not reach that target with oral PrEP alone. We need injectable PrEP on formularies, in coverage schemes, in community hands, and we need it right away. We also need to close the competency gap, that vast, persistent, quietly devastating gap between what a specialist knows and what community health worker in a rural province is equipped to do. We have the technology to change this. We can train doctors, nurses, and community health workers across the entire APEC region through rigorous evidence-based online curricula, grounded in human rights, gender, and diversity, covering HIV, PrEP, STIs, and positive sexuality, without anyone having to travel, without anyone being left behind because of geography. The gap is a policy choice, and it can be reversed. But there is something that no medicine, no program, and no policy can fix on its own. And I want to say it plainly, because after 23 years in civil society, this is the lesson I carry most deeply. No innovation, no medicine, no policy works when the person who needs it is ashamed to ask for it. When a person feels shame for asking PrEP, they won't ask. When a young person feels fear revealing their sexual orientation in a healthcare setting, they disappear from the system. When health workers communicate through gestures, silences, through the words they choose or withhold, that sexuality is something murky and dangerous, we're not building a health system. We're building a system of exclusion with clinical furniture around it. We must eradicate the culture of discrimination and stigma around sexuality. Not sexuality as a risk, sexuality as a right, as a source of well-being, as part of every person's life project. Positive, pleasurable, self-determined sexually is public health, and protecting it is a state obligation, not a progressive aspiration, not a cultural preference, an obligation. If the implementation of this action plan does not dismantle structural stigma in clinics, in protocols, in the attitudes of people who deliver care, then every other pillar will be built on a cracked foundation. So what I do ask of you, of the governments in this room, of the multilateral agencies, of the partners who will leave this event and return to their offices. In the next 12 months, please remove one legal barrier that is stopping people from accessing HIV services. Fund one community-led organization to be a real part of your national implementation plan. Accelerate the regulatory pathway for injectable PrEP in your economy. Invest in online rights-based training for your frontline health workers. And ask yourselves, genuinely ask, whether the people most affected by this epidemic are at the table when you make the decisions, or only when we need their stories to justify the work. This action plan gives us a shared language, a shared commitment, a shared compass. But compasses are only useful if someone has the courage to follow them into difficult terrain as the times we live in. The communities I represent in Mexico, across Latin America, across the APEC region, we're watching. We're ready to be your partners, and we will hold every pillar of this plan to accountability. Because this epidemic does not wait for us to be ready, and neither will we. Thank you very much.
Wow, Rodrigo, thank you so much. Very powerful and important closing reflections, beautifully said. An action plan is not an action yet, and certainly not without our communities and people living with HIV as a critical instrumental partner. So kudos to you and huge round of applause. Not much more needs to be said, I don't think, by anyone. Very wonderful closing reflections to wrap up on. I will say, as I share sort of the final slide here so that people can have a chance to download the action plan. Again, it's also available on our website at APEC-HIV. Here's the action plan here. You can download it on that QR code. But let me say thank you to all the speakers and participants for joining today's launch of the APEC Action Plan to end the HIV epidemic 2026 to 2031. The action plan is now available. It's now launched for use by APEC economies, for governments, partners, academics, clinicians, community members, civil society around the world in the APEC region. It's available for implementation. Please reach out to your partners, reach out to your APEC Health Working Group members to be involved and continue to be informed about the work happening in APEC, both with Chinese Taipei's great new project, with our complementary project we have planned together with China and other APEC economies. Just thank you. Thank you to all of our speakers. That concludes today's event, and we look forward to working together. Please share the plan widely on social media, and we'll be in touch, and together we can make this happen. Thank you, everyone.